Hello and welcome to another bulletin where we focus on Omicron. I'm Milan Sharma. First, let's look at the latest Omicron tally in the country. We're looking at 1,700 cases of Omicron that are being reported from states like Maharashtra leading the tally, with Delhi, Kerala, Gujarat and Tamil Nadu. 639 people in India have recovered as well from the infection. The number of cases in India have reached more than 33,000, and at 750 at the moment. The daily positivity rate is also above 3% in the national level, with over 10,000 recoveries in just 24 hours. Well, it's a big day for India as vaccines for teenagers are open today, with those aged between 15 to 18 years stepping out to take their first COVID shot. Children were excited and we met some of them. They have registered in large numbers as well. Let's listen in.
डर तो नहीं था बट अच्छा लगा क्योंकि अभी ओमिक्रॉन भी आ रहा है तो थोड़ा हम सेफ रहेंगे इससे और जल्दी जल्दी सेकेंड डोज भी लगवा के हम थोड़ा सेफ रहेंगे और उसके बाद फिर भी हमें फॉलो करना चाहिए अभी जो भी कोविड के रेस्ट्रिक्शंस हैं.
अच्छा रहा है मेरा भी. ज़्यादा दर्द तो बिल्कुल नहीं है मुझे, बल्कि पता भी नहीं चल रहा है कि वैक्सीन लगी है कि नहीं लगी. बट अच्छा है, सबको मैं बोलूँगा कि आप भी वैक्सीन लगाएं.
और सर मेरे मायने से ये सरकार ने कदम लिया है, बहुत ही महत्वपूर्ण कदम है, क्योंकि अब तो जैसे हमारे पास ओमिक्रॉन भी आ गया है तो पहले की वेव्स, अब ओमिक्रॉन से भी हमें बचना तो है और जो पहले की वेव्स आ चुकी हैं उससे भी इस पीढ़ी को बचाने के लिए सरकार ने महत्वपूर्ण कदम लिए.
We also tell you all about children's vaccinations and which are the other vaccines apart from the one that has already been approved by the government of India for children. So apart from Bharat Biotech's Covaxin, we have Zydus Cadila Zycov-D. Although it's been approved for children from 12 years, it's not being given to children in India yet and will only be given to adults in near future. Covovax, which is Novavax and Serum Institute's vaccine. It has been approved for adults. Trials have been done on children till the age of 2 years. The application is under review with the Drug Controller General. Biological E's Corbevax has also been approved for those above the age of 18. Trials on children have been done till the age of 5 years. We're also expecting Bharat Biotech's intranasal vaccine, which is under phase 3 trials currently, which will also be given to children once approved. Well, a controversy has been created on the very day that Covaxin is being administered to teenagers from 15 to 18 years of age. Several reports on social media cropped up after Bharat Biotech began picking up stocks of its unused COVID-19 vaccines and relabeling them with an expiration date which is updated. Every vaccine maker does a sterility and stability study to assess how much is the vaccine's shelf life going to be. Covaxin has received an extension from the Drug Controller General. It's an extension of 12 months. And that extension was received by the drug maker in November 2021. The company had submitted a data to the drug authority, and only after looking at this data have they been given this extension. It's not just Covaxin, let me tell you, it's also Covishield, because Serum Institute of India had also done sterility and stability studies on their vaccine to increase the shelf life of the vaccinations. These are ongoing studies. They are done to assess whether the vaccines remain safer for use in controlled and managed temperatures when they are stored for vaccination. So there's no need to panic. Covaxin has not expired. Well, joining me now is Dr. Dhiren Gupta, who is a senior pediatrician as well as pulmonologist at the Sir Gangaram Hospital in Delhi, to decode myths on vaccination for children. Dr. Dhiren Gupta, thank you so much for joining me. First of all, there are questions that have come up from parents now. When should the children not go in for a vaccination, or is there some comorbidity that they have that they should avoid vaccinating themselves?
In fact, if there is any sort of comorbidity like obesity, hypertension, diabetes, they should be given priority. And I would like to extend that pediatric patients beyond 5 years, if we are going to safety data, especially with comorbidity, should be given priority and should vaccinate not only 15 to 18 years. So it's the other way around.
So, another question that most parents were asking was also if the child has some kind of allergy or a skin allergy, should he or she be taking the vaccine at the moment?
Yeah, if you look at our data, especially with Covaxin, probably it is one of the safest vaccine as compared to Covishield, as compared to mRNA vaccine. Any vaccine, if you compare, this has got the safety, maximum safety data. You may doubt some antibody, number of antibody production is less than Covishield, that is different issue. But when we talk about safety, whether it's allergy, whether it's a comorbidity, whether any bleeding tendency, it is the safest vaccine.
So, and how should children learn to monitor adverse events following immunization? Because that is a very important aspect of getting vaccinated, to make sure that you have not faced any adverse event.
Yeah, one beauty about pediatric age group is that the smaller the child, less they are reactogenic. Reactogenic in the sense that they don't produce so much side effect. And that's why we subject our kids to a lot of vaccines, not only one vaccine in a day. At times we give 2 vaccines, 3 vaccines, and they tolerate it very well as compared to adult. And you must have seen adult, there's so much hesitancy because they have a lot of side effects. If I say any vaccine, if I give it to a 2-year-old child, and the same vaccine, if I inject in an adult, the reaction will be 10 times. So that's why even data says that otherwise also Covaxin, I told you that is very less reactogenic in the sense side effects. And the same was proven in the pediatric trials also. The side effects are very minimal. And except local pain, nothing, no single side effect was found in their data.
Well, thank you so much, Dr. Dhiren Gupta, for joining us on this special broadcast on Omicron. Let's now look at what's the Omicron situation and the news from the world. In one of the latest studies that have come up now, more symptoms of Omicron are being reported, and this time the symptoms are vomiting and loss of appetite as well. It's similar to the one we saw during the Delta wave. The Zoe COVID app study has been done where people are reporting these symptoms as well, along with the scratchy throat that has been the dominant symptom this time as the Omicron infection continues to spread across the world at the moment. So if you are experiencing vomiting or even loss of appetite, it's always better to get self-tested for the infection. Well, that's all we have for you in this bulletin, and thank you so much for watching India Today. Stay tuned to indiatoday.in.